Good morning, everyone. Welcome to today's show organized by Healthcare Awareness Society of Australia. I am Dr. Aziz Rahman. I am an Associate Professor of Public Health and Associate Dean Research at Federation University, Australia. I'm going to host today's exciting program. So this ongoing pandemic has impacted on our lives in different ways. While many of us are impacted directly, many indirect health implications are not visible quite often. Many people with pre-existing illness changed their health-seeking behavior, did not turn up for follow-up, or delayed their treatment. Many people who were due to screening tests postponed those, which potentially put them at risk of not detecting the underlying disease at an early stage. Therefore, we have invited a number of specialists today for our program, and Healthcare Awareness Society of Australia is doing this weekly multicultural community awareness session so that it will improve awareness in our community settings. So I would like to introduce you with today's panel. Today we have Dr. Bidhu Mohapatra, who is a consultant endocrinologist and obesity specialist. He's working at Airport Hospital. Welcome, Bidhu.
Thank you, Dr. Aziz.
We have with us Dr. Madhu Singh, who is a consultant medical oncologist, who is working as a staff specialist in medical oncology at University Hospital, Geelong. Welcome, Madhu.
Hi.
We have with us Dr. Raju Yerra, who is a consultant neurologist and epileptologist, who is working at Royal Melbourne Hospital and Director of Comprehensive Neurological Care, Victoria. Welcome, Raju.
Thank you, Aziz, and thanks for having me here.
And we have also with us Dr. Rinku Rayoo, who is a consultant cardiologist, who is a cardiac imaging and heart failure specialist, and who is also the director of Southern Cross Cardiovascular Services. Welcome, Rinku.
Thank you, Dr. Aziz, and a very good morning to the audience.
I would also like to acknowledge our media partner today, who is the Indian Sun TV, and who are dedicating their media service with us, with Healthcare Awareness Society of Australia, throughout our weekly program. Now, for today's session, please feel free to post your questions in the Facebook chat box, and we'll try to respond to all of your questions as much as possible. So without further ado, let's talk with our specialist today. We'll try to focus about all of those scenarios that they are facing in their daily practice. So at first, if I go to Dr. Madhu Singh about your specialist in cancer. So in your practice, what's happening in terms of the cancer diagnosis, whether you are seeing the patients at a later stage, or what is the impact of this pandemic that you are seeing in the cancer patients?
Thanks, Aziz. So I'm a cancer doctor, and generally, as a rule of thumb, the sooner we diagnose a cancer, the better the outcomes are. So usually that may translate that the survival rate changes as the stage of the cancer changes, and if a cancer is caught early, then hopefully it can be caught at an early stage. Because of this pandemic, the medical care of lots of people have been compromised, and people are not really presenting to the doctors in time because of the restriction on the services. Also, all the routine cancer early detection programs like the breast screening program, the pap smear, the cervical screening program, the bowel cancer screening program has been compromised. So anecdotally, I've seen that a large number of people are now presenting at a later stage, which means at a more advanced stage of cancer. And the medical fraternity, especially the oncology cancer fraternity, is extremely concerned that we are going to have a big tsunami of patients coming who have an advanced stage cancer, and the outcomes in the next few years may not be as good as the outcomes have been in the last few years.
Thanks, Madhu. So that's really important thing to for our community members, those who have delayed their screening process, who are due and they miss those diagnoses. And as you have mentioned, so if they miss those things, so they are presenting at the later stage. Now, if I talk about the diabetes, if I come to Dr. Bidhu, so what's your experience? What you're seeing in terms of delayed diagnosis for any endocrine disease, specifically diabetes?
Actually, in my practice, there are a number of factors that I can see which can delay the diagnosis in the diabetes and obesity. The most important are what I find that the lack of access to the healthcare system. Because the last 2 years, what we find there is a complete change in the focus in the healthcare system. So what we are doing in the past, we are doing more emphasis on the chronic disease. But for the last 2 years, the entire focus has changed. It just shifted. And so the hospital system is completely full. There is no appointments with the GPs, no appointment with the specialists. So due to the limited access, the people and the patients, they can't come to the hospital or to the doctors in the right time. And also what I find, the people are trying to cancel and postpone their appointments. That is because of two reasons. The one is they're trying to scare of having this exposure to the COVID. And also they find that there is a limited services available with the healthcare providers. So all these factors can cause in the delay in the diagnosis of the patient, particularly in my field, in the diabetes. So what I see in my practice, that more and more patients coming, that particularly type 1 diabetes, is coming to with the severe complications like DKA, which is not there as much as we find now. And also in type 2 diabetes, patients are coming with severe hyperglycemia because they came to the hospital, came to the doctors in the late stage. And all these things is causing in the delay in the diagnosis and increased rate of complications. So what I will say to my patients, that please don't cancel your appointment. Try to stay in your appointments. If you can't come, you can contact your doctor. You can do your telehealth, and there are many ways you can contact your doctor, and try to get access to them, and take your medicines, take your blood sugar, and that's the key for these things.
Thank you, Dr. Bidhu. And you have mentioned a good point about the change of this health-seeking behavior. And our government has provided these telehealth facilities at the beginning of this pandemic, and still it's ongoing. So people can access those services to reach their specialist. Now, if I talk about the neurological diseases, I'll come to Dr. Raju. So what are the things that you are seeing in your practice, whether you are also seeing the same delayed in the diagnosis of neurological presentation or the diagnosis?
Well, Aziz, the positive thing about it is that in private practice, however, both in my outpatients in Royal Melbourne Hospital and in our private practice, to their credit, about 90-95% of the people are turning up for the appointments. So that's a good thing. But the unfortunate thing is that because they have not seen their general practitioners for a fairly long time, because most of them are doing, it's no criticism of the general practitioners, the reluctancy of the patients, new patients in particular, going to their seeking medical opinion, then there is delay in diagnosis. Young people in their formative years, if they don't go to the school, they don't learn, they will never, that will carry with them. Similar to that, in older people, when they lose a function, whether they're balance or, a balance, gait problems and falls, once they lose them, it's very hard to get them back. So, for example, the typical story that when Raj asked me about this participation in this thing, that thing that came to me was that a 72-year-old man who is completely well and healthy, 3 years ago started having problems with his walking. So he saw the GP. GP quite appropriately thought you got bad knees. So we'll send you to the orthopedic surgeon. And then he never got an opportunity to see the general practitioner. So when he finally came to see me, say about 18 months into the COVID, he was walking with a 4-wheel frame. Obviously, this gentleman had severe Parkinson's disease, so which was put down to the bad knees, which he certainly has, but that's not the whole story. So, this is the kind of delays in diagnosis. Once they lose their function, it's very hard to get it back to that. But he's doing well at this point of time. The many other things that come to my mind is that people are reluctant to go and have tests, but particularly in the public hospitals. So when I suspect somebody with multiple sclerosis, I want them to have, an eye test or a lumbar puncture. They don't want to go to the public hospital. And a lot of my elderly patients with dementias, for example, Greek, Italian patients, they generally go to their social clubs, which gives them social stimulation, keeps their functional abilities. They are not leaving home. They're not interacting with anybody. So they are significantly losing out on interaction, and their social function is getting worse, and then they are declining faster. So these are all the things that are happening in the neurological. It's not as bad as what's happening with oncology or DKA, but it's still, having enormous effect.
Thanks, Dr. Raju, and thanks for sharing the specific example in your practice. Now, we are talking about all the chronic diseases, and one of these important diseases, could be life-threatening disease like cardiovascular disease. So I'll talk with Dr. Rinku. What's your experience during this COVID? Would you understand if there is an acute episode of this cardiovascular disease, people will turn to the emergency, but whether you are seeing any impact of delayed presentation of the emergency situation for our heart diseases?
Yeah, thanks again, Dr. Aziz. Cardiovascular disease as such, in my practice, we have seen slight increase in delayed presentation of myocardial infarction. There are a few patients where, particularly in the initial part of the pandemic, where people were a bit more scared, chest pain, they will ignore it or think that we can maybe not have tests at the moment. And then I've seen a few cases where they had completed infarcts, and even one patient with a clot inside their heart. In the second phase of the pandemic, particularly this year, I think there has been a lot of education around not ignoring your symptoms, and we're seeing less of it. The second aspect, which I think my other colleagues have mentioned as well, is longer waiting times, particularly in public system for screening tests. There has been a bit of a delay, which is part in due to the reluctance of the patients to go to public hospitals because of the COVID scare, and part in particularly recently reducing elective procedures, and then the delay spills over. I think we're going to see more and more of this once this pandemic ends, and we'll see more patients with advanced cardiovascular disease, which has been missed over the last 2 years.
Thanks, Dr. Rinku. So what we are hearing from all the panel of experts today is about the reluctance of the patients to go to either the public hospital or going to the GPs, and that's indirectly impacting on their diagnosis. Now, if you think of the treatment or what is the consequence of this thing for this delay, and many of those chronic diseases need regular follow-up regarding probably the regular tests or the change of medication. So what are the things that you are seeing, Dr. Raju, in terms of the delayed treatment for your patients in the neurological aspect?
Well, as I said, not so much as cancer, but at the same time, delay in diagnosis of multiple sclerosis. The early you start the treatment, the better the outcomes are. A bit like what my other colleagues are saying. The other important aspect is losing the function. So in elderly people with Parkinson's disease, you go to treatment, and elderly people with dementia, you need that social interaction, going out, meeting people. Then otherwise, they lose their language function, they lose their interaction ability to interact with people. So these are all the complications that we are seeing.
Thanks. Now, if we talk about the cardiac issues, cardiac management, and cardiac complications for any delay, what is your experience, Dr. Rinku?
So, look, I would flag an example of heart failure management in particular. Over the last couple of years since the pandemic has started, telehealth, we've used it, and I'm thankful that it is there. At least we can manage it somehow. The rest of the conditions, but heart failure, telehealth is not ideal, because you want to see the patient, you want to see their clinical fluid status, and again, elderly patients, it's hard to communicate with them through telehealth, whether it's video calls or whether it is telephone calls. So that's one aspect of cardiology management that was difficult to manage. But look, we try and minimize telehealth in these patients if we can see them face to face. The second aspect I would flag on the cardiology side is cardiac rehabilitation. Cardiac rehab pre-pandemic has been a face-to-face experience. Post-pandemic, number one, there was a delay. I mean, most of the patients usually will get cardiac rehab within 3 to 4 weeks of the surgery or the procedure. But after the pandemic, I've seen patients even after 3 months, they haven't had an opportunity to go into rehab. Even if it was available, it was virtual, which again, in an elderly subset of population and a lot of non-English speaking background populations, it has been hard. And then cardiac risk optimization, again, has been a bit difficult, because I call it pandemic diet. A lot of people lose motivation, and they eat more. They have been gaining weight, which I think Bidhu again will mention, because he is an obesity specialist, but it has an impact on their cardiovascular risk long term as well. And that ultimately, we see the cholesterol going up. We will see more in next few years when the cardiovascular events will increase.
Thanks, Dr. Rinku. So that's really alarming, because if people are missing those cardiac rehab, and if they are not doing the lifestyle modification and all of this, and we are expecting a huge impact at the later stage. So that's a really great concern. Now, you have mentioned about the obesity. I'll come to Dr. Bidhu about this. So what are the things that you were saying specifically? If I talk about the children, is there anything that you are noticing among children? Is there any change in the diagnosis or the treatment for obesity?
Yeah, actually, Dr. Aziz, this is a good question. That if you are asking about the children, then what I can say, because of the stay-at-home order and the schools are closed, so what is happening now? The most of the children, they're staying at home, and they have no exercise. They're having a poor diet. So all these things have increased their chance of cardiovascular risk. There is increased risk of type 2 diabetes, and there is increased risk of obesity. And so what I would say that particular to the parents, if you know that your children, they're staying at home, just try to encourage them to do some exercise, try to give them healthy food, try to give them home cooked food, not to give much food from outside. And also what I find that, and delay in the treatment aspect, what I find that people have having the difficulty to access the pathology, because people are scared going to the pathology service to avoid the exposure. At the same time, people have difficulty to access to the pharmacy. They don't want to go there. We know that we have a system of e-script, but not many people are getting access through that system. And as we told that the public system and the GP appointments is completely overwhelmed. And I'll give you an example, like, particularly in diabetes, people with diabetic and foot ulcer, they should come to us in the early stage. But due to the current situations, they're coming in the late stage. So what is happening, what we can anticipate, but maybe over the next few years, maybe in a few months' time, there may be higher risk of amputations because they're not coming in the right time. And there is an increased risk of cardiovascular complications if you don't come in the right time and the treatment is delayed. So what I'll tell to the people or to my audience, that if you are taking any steroids, if your blood sugars are high, please check your blood sugar regularly. And if you are not eating well, particularly if you are taking your insulin, there's a high risk of hypoglycemia. So the key is to check the blood sugar regularly and try to be in contact with your medical professionals. And you can contact by the telehealth, or you can contact your GP. And so that's the most important things. And if you do come to the hospital due to any acute complications, please bring your medications list so that we'll know that what are the medications you are taking, what type of insulin you are taking. And also, like in these days, if you are any diabetes technology, like if you are any insulin pumps, or you are taking continuous glucose monitoring, or like a flash glucose monitoring like Libre, something. There are many newer diabetes technology. Please bring with you to the hospital or to the doctors, bring it with them so that we'll know that what's going on and we could treat appropriately.
Thanks, Dr. Bidhu. So that's really comprehensive. So we got a question from Gerald. Should vaccinated people with chronic disease like diabetes do more checkups to monitor their condition? If you want to respond, Dr. Bidhu, please.
Sorry, can you tell the question again?
Should vaccinated people with chronic disease like diabetes do more checkups to monitor their condition?
Okay, that's a very good question. Look, if you are a diabetes, if you are taking any vaccinations, there may be a short-term change in your blood sugar levels. Your blood sugar may go up or may go down by maybe a day or two. In my practice, I have seen the patient like in 50-50%. Time people coming, okay, my blood sugar went up for the first couple of days, and some people come with a hypoglycemia. So what I'll tell that we don't have sufficient study at this stage that what is really happening after the vaccination. But what we do know that there is change in something in the blood sugar. It may be up or it may be down, but there is no long-term effect. It is a short-term effect, maybe a day or two. So what I'll tell that to prevent those things, you need to check the blood sugar more frequently. And if you find the blood sugar is going low, try to reduce the dose of insulin if you are taking, or if you are taking any oral glucose medications, then you have to talk to your doctors and change the medications. And if the blood sugar is higher, in the same way, we have to titrate your medications.
Thanks, Dr. Bidhu. Now, I'll come to Dr. Madhusudan. In terms of the cancer treatment, when it is predominantly probably the radiotherapy or chemotherapy, so is there any change in the treatment or the follow-up of the patient that you are observing during this pandemic?
So fortunately, the cancer patients are considered as category 1 patients. So of course there is a delay in diagnosing the cancer, but once the cancer is diagnosed, then at least so far things have moved rather quickly. Or so far we have been able to maintain our standards and try to operate on these people in time and give them the appropriate chemotherapy or radiation or hormonal treatment or whatever else they need in time. Of course, the lack of rehabilitation facilities, because sometimes the system is too overwhelmed, or because of the lack of ICU facilities, at times has delayed the dates of elective surgeries for these people. But so far, so good. And I hope that the situation continues to improve rather than decline in the coming weeks.
Thanks, Dr. Madhusudan. So, dear viewers, you are watching the program organized by Healthcare Awareness Society of Australia, and we are today we are talking about the indirect implications of COVID-19. Now, so far we have heard about the impact on different systems and different chronic diseases like cardiac diseases, endocrine diseases, neurological diseases, and cancer. And due to the delay in diagnosis and treatment, there could be some impact on this thing in the short term and long term. We have already heard about these things, so we want to know a bit more about what could be the immediate impact and what could be the long-term impact. So if I come to Dr. Bidhu again, so what would be your prediction about this thing, and what are the things that you are seeing? And for this pandemic, it is almost 2 years now. So what are the immediate and long-term impacts for this delay in diagnosis or treatment?
Okay, so in my practice, is a very common questions. My patient used to ask me, doctor, I have the type 2 diabetes. Do I have the increased risk of having COVID infections? The simple answer is we don't know at this stage. We have a different stress study. We have a Chinese study, we have a US study, we have a French study. None of the study has proven that someone having the type 2 diabetes or type 1 diabetes has increased risk of having COVID infections. But what we do know, that if you are having a diabetes, there is an increased risk of complications from the COVID infections. So if you get the COVID infections, there is increased risk of the complications. That means you have an increased risk of going to the hospital. You have increased risk of to be admitted in ICU, and you are increased risk of to be in the ventilator. So the key is we need to control your blood sugar, because those cohort of patients who are going to the hospital, we find that those patients who have poor glycemic control, that means the glucose control is very poor, they are more likely to develop those types of complications. And also people having older age and having increasing cardiovascular risk, like increased risk of cardiovascular disease, having a chronic kidney disease, and having obesity. So those are the risks you are having a higher risk of complications. So the key message is try to control your blood sugar. So if you get these COVID infections, then your chance of having serious complications is low. And at the same time, I'll talk about the indirect effect. Like, as we had talked, there is a delay in the diagnosis, delay in the treatment. And also, people are staying at home, they're not going outside to prevent the exposure. And there's, our children, they're staying at home because of school closure. So all these things has made the poor lifestyle change, so that we have reduced in exercise, poor dietary intake, and poor mental health, increase in risk of anxiety and depression, and significant financial burden. So all these things is contributing to the direct and the indirect effect.
Thanks, Dr. Madhu. So I will come to Dr. Rinku. So what's happening in terms of cardiac patients? What could be the immediate and long-term impacts of those patients?
Thanks again, Dr. Aziz. Look, direct effect-wise, I know we're going to talk about vaccination later, and there is a lot of concern about myocarditis and pericarditis due to vaccination. But I will emphasize it again that it's more likely if someone catches COVID, that the complications like myocarditis and pericarditis happen a lot more common. And there are a few studies where roughly 2/3 of the patients, and particularly young men who tend to get myocarditis. Again, coming to the longer term aspect, what we have seen is long COVID. It is the thing. It affects people adversely. From cardiac perspective, they are short of breath for a long time. They're tachycardic for a long time. And we tend to manage them as if they have heart failure, as if they are running on their reserve already. As my good friend Bidhu mentioned already, the indirect effect, it's a lifestyle thing, lack of motivation. People are not doing as they would in normal circumstances, with their mental health being affected as well. So the lifestyle optimization, which I have flagged previously as well, is lacking. So there are direct and indirect effects of COVID, which we need to deal with, which we are trying to deal with. But as we keep on going with our discussion, vaccination is the thing to do.
Thanks, Dr. Rinku. So that's really reassuring, and we'll talk about the vaccination very soon. So we know that early diagnosis is really important for many diseases, specifically cancer. And Dr. Madhu, you have already mentioned about the importance of doing the screening test. So what are the indirect and direct implications that you can forecast regarding your patients?
So internationally, we have seen a few studies have been presented which have proven that cancer patients who get COVID, even if they're not on active treatment, they have worse mortality. So all other factors remaining same, if a person does have cancer, then the chances of that person not making through is increased. Of course, lack of social support, lack of ability to seek medical help, all of those factors do make a significant contribution in the overall outcome from the cancer. For example, lots of people may choose not to have the cancer treatment because their son or daughter who is living overseas or who is living in a different state or even in the same city can't really come and look after them at home. So overall, the outcomes are significantly worse in the cancer patients who are affected by the COVID.
Thanks, Dr. Madhu. So now, what about the neurological issues, the neurological complications, if there is a delay in the diagnosis and treatment, Dr. Raju?
Well, yes, early treatment always is beneficial in controlling the disorders better. There's no doubt about that. Aziz, another thing is that, as I mentioned previously, once people, particularly elderly people, lose their function, it's very hard to get it back. They have to relearn to walk again, avoiding falls, those kind of things are very important. And also it applies to people with early dementia as well. So if you intervene early, put them into appropriate programs and keep them active, start them on the treatment, then they will keep functioning longer in the community before they end up in the nursing home. So early diagnosis, early interventions are always very important.
Thanks, Dr. Raju. Now, we'll come to the COVID vaccination, what is really a hot topic. And we are seeing really promising response among the people to take up the vaccination. So that's really good. And we are really eagerly waiting to reach those milestones of 70%, 80% of those both doses. But I guess the common concern among the people who are having this type of chronic diseases that you have discussed today, including the cardiac disease, neurological disease, endocrine disease, or the having cancer. So there could be common concern whether taking the vaccine will cause that disease, whether that will aggravate the disease, whether it is safe to take the vaccine. So that could be lots of confusion in the committee members. So let's talk about those issues. So if I come to Madhusudan at first, so what's your view about this COVID vaccination and cancer patients?
So the cancer patient population is a very vulnerable population. The chance of a cancer patient not doing well from COVID is very high. On top of it, the patients who do have cancer may be on immunosuppressive treatment like chemotherapy or maybe getting hormonal treatment or radiation treatment, or may have other medical issues. So the first step, is it safe for the cancer patients to have vaccination? Yes, absolutely. It has been proven that the COVID vaccination is completely safe in the cancer patients. Does it save lives? Absolutely, it does save lives. So I tell each and every patient of mine that they must have the COVID vaccination. It is thought that probably the cancer patient does not mount as good an immune response as a normal person does, or a person who does not have cancer does, and that is really relevant. So nowadays, the ATAGI, the organization which recommends the Australian government about the vaccination, has recommended that people who have cancer and other medications and other medical conditions where the immune system is significantly compromised should have a third dose of vaccination. And it is recommended that the third dose should preferably be an mRNA vaccine, so which means either Pfizer vaccination or Moderna vaccination. So that includes people who have blood cancers, that include people who are on chemotherapy or hormonal treatment or on radiation treatment, or people who have who are on steroids either for cancer or for other conditions, and a few other specific circumstances.
Thanks, Dr. Madhu. We've got a question from Dr. Preeti Khilan. How far are we with the booster dose of COVID-19 vaccine in cancer patients? So you have mentioned it is recommended. So do you know when it is going to start?
So it has been recommended by the ATAGI. It should become available within the next few days. The third dose of vaccination for the vulnerable population.
Thanks, Dr. Madhu. So in terms of this COVID vaccination, at the beginning when the vaccine was rolled out, there was a lots of confusion and people were hesitant to take the vaccine, specifically the AstraZeneca, because of those side effects. Although those are really rare, but people were still hesitant to take that vaccine. And then when Pfizer vaccine started, people started taking the vaccine. And then that issue came up regarding the complications of Pfizer vaccine. And although that is really rare, this pericarditis and all of those issues, but still there could be some confusion, and especially the people with heart disease, that they may be really concerned about taking up this vaccine. So what would be your view on these issues, Dr. Rinku?
Yeah, I think COVID vaccination and cardiovascular and cardiac issues is quite a topical topic at the moment. What I can reassure everyone is all the vaccines that are available, they're safe. So taking up the issue of mRNA vaccines, there's a lot of reluctance in the community about the side effects of both the vaccines, but I will focus mainly on the mRNA-based vaccines because the side effects that I mentioned are pericarditis and myocarditis. What I can reassure everyone is these side effects are really, really rare compared to someone who catches COVID. The risks that have been quoted is just 12.6 per million with these, and particularly the second dose in young adults. We here in Australia have clear-cut guidelines when not to administer mRNA vaccines. And if someone has had pericarditis or myocarditis active within the last 6 months, they should not receive an mRNA-based vaccine. They should discuss their option of getting a vaccine like AstraZeneca after discussion with your GP or the vaccine provider. Discuss the pros and cons of that, and I again recommend that that's the strategy for those rare patients. If you compare effects of particularly these pericarditis and myocarditis compared to other vaccines. We've been dealing with vaccines since 1960s when we started with smallpox vaccine, which was a live vaccine. And even with those vaccines, we had patients who would develop pericarditis and myocarditis. But the message is clear. You don't want to catch COVID and then have a high chance of developing myocarditis or pericarditis. You're better off having a vaccine which is safe and have been proven to be safe, and just go out there, have a discussion with your doctors if you have any concerns, if there is any other misinformation there, because vaccines are really safe.
Thanks, Dr. Rinku. So that's really reassuring to our community people today. So you were listening from all the experts today, and they're reassuring you it is really important to get the vaccine. Otherwise, the consequence of getting the COVID is really there compared to the very, very, very rare complications that we are seeing in the media. Now, in terms of this COVID vaccination, Dr. Raju, is there any possible neurological complications that may happen due to any of those COVID vaccinations that is approved in Australia?
Of course, a lot of neurological complications have been reported with mainly the AstraZeneca vaccine, and not many. There's an anecdotal report from the mRNA vaccines, but neurological complications wise, the mRNA vaccines do not have much to worry about actually. But when it comes to AstraZeneca, unfortunately, there is that risk of cerebral venous thrombosis, and I was just looking up the data. So far, there have been a very handful of cases, even that I think the risk is about, if you're less than 50, it is 5 in a million. Okay, if you are above 50, it is 1 in a million. So the risk is extremely low. But there is that clots in the brain is a risk with AstraZeneca vaccine, and AstraZeneca vaccine has been shown to have other complications such as demyelination, where there is a nerve damage in the brain or in the peripheral nerves. But overall risk is extremely and exceedingly small compared to the real risk of catching COVID and having, of course, if you catch COVID, you can have innumerable neurological complications. You can have strokes, you can have muscle weakness, you can have nerve damage, you can have so many things. And what all that could happen with the vaccine, I would say it's hundreds to 1,000 times more you could have with the COVID itself. So yes, there are complications reported, but they're exceedingly and extremely rare, and people should go ahead and have it. On that note, actually, if you look at the interesting thing is that now we are in a time in Australia where nobody is going to have any more AstraZeneca vaccine. So it's all going to be Moderna and Pfizer. So mRNA vaccines from here on, no matter how old you are, unless there is a significant contraindication, allergy to that particular thing, or a previous history of pericarditis, as Rinku said. So let's take the AstraZeneca out of the equation. Most of the reports, interestingly, from the vaccination are functional neurological disorders. What it means is that people are worried about having a problem. Believe it or not, I'm seeing a patient once every week or two where they have had a Pfizer vaccine. I haven't seen a Mrna patients, but Pfizer vaccine, and they come to me, have tingles in the right arm, tingles in the left arm, or a weakness in this leg. So people's anxiety is what is presenting them as a functional. So it's not real, and it's not that they're imagining, but they are worried about these things, and then it manifests as a physical symptom. When you worry a lot, it can manifest as a physical symptom. So the only real neurological complication that we are seeing with the mRNA vaccines is functional neurological disorders. That's happening worldwide. Going to the doctors, saying that, particularly neurologists saying that about a tingle here, there, or everything. So my message is very clear. Extremely low risk of any complications, particularly with the vaccine that we have here. Even with AstraZeneca, it is extremely low. So go ahead and get vaccinated. Otherwise, the risk of COVID is real, and then thousands of times more.
Excellent. Thanks, Dr. Raju. Now I'll come to Dr. Bidhu. What about the possible complications that people may be worried about after taking the COVID vaccine, whether that will impact on their diabetes or any other endocrine disorders?
Okay, this is a very great and good question. This is a very common question I've been asked by my patients. I used to get 2 or 3 phone calls and every day. Doctors, I have the type 2 diabetes or type 1 diabetes. Do I have to take the vaccine? And also, if I'm going to take the vaccine, what type of vaccine I'm going to take? And if I'm going to take the vaccine, do I have the risk of having complications? I'll just answer the first questions. Do I have to take the vaccine? The answer is 100% yes. Because we hear a lot of devastating news that there are people dying in ICU, people dying in the hospital. The only way we can prevent this pandemic, we can prevent the serious complications is by taking the vaccines. Then it comes to what type of vaccines? Like, people are talking about 60%, 70%, 80%, 90%. Please don't look at this number. All the vaccines are safe. All the vaccines are very effective. It is more than 0%. So whatever is available, you just talk to your doctor, talk to your GP, and get your vaccine as soon as possible. Don't get delay. This is my message. And also, like people ask, once you take the vaccine, is there any risk of complications? I'll just talk about my patients, patients having the diabetes. I'll tell there may be a certain change in the blood sugar level, maybe a day or 2, as I told in the past, that it may be going up or down, but that can be easily managed. Please stay in contact with your doctor, contact with your specialist, that this is happening. This is a minor things that can be managed. But so far, in the diabetes patient, we don't have sufficient review or literature that it has got any serious impact in the long term. And also, I would like to tell one thing to my audience, that nowadays people are using in type 2 or type 1 diabetes a lot of diabetic technology. They're using the CGM. They're using the sensor for the glucose monitoring. There's a small patch we stay in the arms, and that continuously check the blood sugar. So they normally ask me, do I take the vaccine on that side? The answer is, it is not a problem at all. I don't see in my practice that any change in the blood sugar level by taking the vaccination in the same arm with your sensor. So please, what I'll give you the message to my audience, that please get your vaccine as soon as possible. If you'll ask me whether I'll get a 3rd dose or 4th dose, I don't know, because I'm not an expert in the vaccine. But please follow the public health order and get your vaccine as soon as possible. And that is the key, and that is the only way we can prevent this pandemic.
Excellent. Thank you very much, Dr. Bidhu. So that's really reassuring. We got a question from our audience. Sanjay has asked about, he's 42 years old. After my Pfizer shots, I had pricking sensation under my feet. It comes and goes. Now it has stopped. But is there anything I need to worry about? If I ask this question to Dr. Raju, please, to respond.
Well, Sanjay, it is like anything, we must not generalize. You cannot, not knowing, yes, you are 42, so assume you are in good health. So congratulations, firstly, on having your vaccine. But please, this is a general advice. I'm going to go by what the literature tells, what my experience tells, but I cannot really advise you on this. I would strongly advise that you see your general practitioner. If there is any concern, they would they would get a neurological opinion. But Sanjay, that the important thing to understand here is that overall, as I mentioned in my previously, the complications, there are about 5 in 1 million risk of clots in the brain with AstraZeneca and people under 50. Okay, so we have seen that signal with that. But whereas with Pfizer, there's an occasional, because the millions and millions have been given around the world. So these kind of problems do occur. Guillain-Barré syndrome or the tingling in the feet and things like that generally occur. So I don't think these what is happening in the community now is any more than what is expected with the Pfizer vaccine. So people still have strokes. People will have strokes whether they have a vaccine or not. What I'm trying to say here is that we are not seeing that people who have had Pfizer vaccine have any more risk of developing any neurological problems compared to the general population. So if there is about, in Victoria, there are about, I think a few hundred people every year will develop Guillain-Barré syndrome. So we are still seeing it. So because 90% of them had one dose of vaccine, so you still see those 100 cases in people who are vaccinated. But it's a correlation between the vaccine and this issue has not been, we have not seen that people who have vaccine have more risk of having that. So Sanjay, my advice here would be, from the literature available, it is very unlikely that Pfizer is causing your symptoms. But at the same time, it is important that you go and see your GP just to make sure that it's something that is incidental that's happening. And I should also add that, as I mentioned before, people are genuinely experiencing a few symptoms, but they turn out to be not related to Pfizer or anything serious. But at the same time, please see your trusted general practitioner. I'm sure he or she will advise you well.
Thanks, Dr. Raju. That's really helpful. Now, we have talked so far about the people with those chronic diseases today, and all the panel of experts provided their expert opinions based on the practice that they are seeing. But it is always better to prevent those diseases rather than having the treatment and doing this, all of these things. So that's my role of the public health. So I would like to mention about those issue of what are the things that we can address to prevent the occurrence of those chronic diseases. And if I share latest statistics from the Austrian Institute of Health and Welfare, it has said that many risk factors, those are preventable, and that is causing 38% of total disease burden in Australia. And among those risk factors, there are 5 key risk factors. Those are causing the most burden, including tobacco use, overweight, dietary intake, hypertension, and alcohol use. So these are the 5 factors that they have identified in Australian population that is contributing more to those disease burden. So that means that indicates it's important to do some lifestyle modifications. And from today's discussion, it also came up from the discussion from Dr. Rinku, Dr. Bidhu. They have mentioned about some of those lifestyle modifications. But we do understand this COVID, this lockdown, that has impacted on some of those lifestyle modifications, say, for example, doing exercise and adapting the healthy behaviors. And when people are at stress, they take up this risky behaviors like smoking and alcohol use. Now, we are near to the end of the session. So today we will talk about what is the lifestyle modification advice that you will provide, considering the circumstances. Although we are hoping to get our freedom back in Victoria and in New South Wales, they have started enjoying the freedom. So what are the things, why it is important from your disciplinary perspective about the lifestyle modification, if I go quickly to all of you? So if I start with Dr. Rinku.
Yeah, I think we discussed this previously as well, and you summarized that quite well. Lack of motivation has been a problem over the last 2 years. And that has prevented a lot of people from going out and exercising. But I tell everyone, one of the reasons to go out here in Victoria is exercise. So take advantage of that, get some fresh air outside, walk at a brisk pace. If you can exercise outdoors or indoors, do it. Have a good, healthy diet plan because it will be good for your mental health as well. Talk to your folks on FaceTime, Zoom, whatever way you can, and try and practice those healthy measures, because last thing we want is having a high burden of cardiovascular disease in future. Because of the limitation of time, I think I'm going to pass on to my other colleagues to say a few words as well.
Thanks, Dr.
Yeah, I mean, I'll tell about the lifestyle modifications. Look, what I feel one of the biggest factors is that the people are confused. What type of lifestyle modification we're going to do? So we are having the 9 or 10 lockdown. So sometimes we can go up to 5 kilometers, sometimes 10, and sometimes 15 kilometers. So people are confused. What they want to do, what type of exercise you want to do, whether you exercise outdoors or in indoors. People are scared to go to outdoors just to avoid exposure. And in the indoors, they're trying to do whatever they can do in exercise. And the gyms are closed, and people are trying to get social distancing. And so people are having poor dietary choices. People that are increased risk of smoking, the increased risk of alcohol intake. And in the schools are closed, and the children are staying at home, and they're eating more and lack of exercise. So all these factors has caused a poor lifestyle. But what I can give a message to them that please do whatever type of exercise you can do, which is available, please do it. Even you can do at home, you can do your yoga, you can try to eat your home cooked food, and try to avoid smoking, and try to minimize alcohol intake.
Excellent, thank you. Dr. Madhu, do you want to add anything?
Yep, of course, all of us know about the smoking and alcohol intake and how that's not good for health. But I'd like to share a very important bit of information which not many people know, that people who actually exercise regularly, their chance of having cancer upfront, so the first time getting the cancer first time, is much lesser than that of people who don't exercise. And even people who have been treated with a curative intent from cancer, their chance of cancer coming back is reduced if they exercise regularly. So as a part of routine follow-up, I always tell my cancer patients to walk briskly at least for 20 minutes a day, up to 3 to 4 times a week. And it has been proven that it brings down the chance of the relapse of the cancer. Of course, it has all the other benefits, the cardiovascular benefits and potential, improvement in the bone health and potential improvement in the mental health. So if exercise was a medication, it will sell fantastically. So let's all exercise regularly.
Thank you. Raju, do you have anything to add?
Well, yeah. I don't. Madhu told us that not many people don't know that actually. Like Madhu said, exercise. Bidhu said, Rinku said, you prevent diabetes, you prevent hypertension, you prevent, but including even the cancer, the deadliest of the conditions. You can not only prevent that, but those who are have got good level, they respond well to the treatment. I'm sure Madhu would agree. And on top of that, you will stay young. You will be handsome, you will live longer, and you will have a better quality of life. There is so many reasons to exercise. So don't give it up.
Thank you. So that's really reassuring from all of the panel of experts today. And you have heard about this lifestyle modification. You have heard about those issues. Yes, Dr. Raju.
Can I'm not sure whether we have time for a message, but the one thing that I want to add is that please go get vaccinated. The risks of vaccinations are extremely, extremely infinitesimally small. So their COVID is real. There are one of the best controlled countries in the world, Australia. We have tens of thousands of people in the community. It's so easy to catch it. You just brush past people, you catch it. Now, we are telling what we are practicing. My 92-year-old father in India, my 80-year-old mother, my 25-year-old son, as it happens, he was in Sydney at the time, he had AstraZeneca. We had Pfizer here. So every one of us are having, my father has advanced, he's 92, he has advanced, emphysema, but still, we had it. So we are all doing it. Go ahead and do it. not for you. You're doing a community a favor, not only yourself a favor, your family a favor, but community in general a favor.
Thank you very much, Dr. Raju. So I would like to thank all the panel of experts today who gave their valuable time to talk with the multicultural communities. And from today's discussion, I'm pretty sure the multicultural community members, they are reassured about their situation. And it's really important to get the vaccination and to see their specialists. Don't delay about the follow-up and the diagnosis and the treatment, because it may have the short-term and long-term impact. So I'd like to thank all the panel of members. I'd also like to thank all the audience today. And we'll come back with another topic in the next week from the Healthcare Awareness Society of Australia. Until then, have a good day. Thank you.
Thank you.
Thank you.
Thank you, Aziz.